Hello, my name is Benjamin Post. I'm an intensive care doctor currently doing a PhD at Imperial College London in artificial intelligence. Today, I'm going to tell you how temporal patterns of primary care usage can be used to predict ICU admission. Routinely collected EHR data is now becoming ubiquitous across many healthcare systems and is a relatively cheap resource for research. These data have been successfully harnessed for a number of predictive tasks, including hospital admission prediction. Research using EHR data has particular challenges, such as sparsity and missingness, which need careful handling. However, this missingness is complex and can be informative. We created a novel feature that explicitly uses the sparsity of EHR data to map the temporal patterns of primary care utilization. We then tested its predictive utility for ICU admission. Temporal patterns were generated by identifying sequential interactions with primary care services and calculating the number of days between each of these events. So for a given patient, a longitudinal representation of their pattern of primary care access was captured. We then explored how the primary care interaction patterns differed for patients admitted to ICU as an emergency. For the year 2018, we identified all patients in Wales that had an ICU admission. We then identified the 10 primary care interactions up to 2 years before their admission and calculated the time differences between these events. We then identified a matched cohort who were not admitted and randomly assigned them a pseudo-admission date in 2018 and performed the same procedure. We then took these 10-dimensional arrays and performed k-means clustering. These clusters were then combined with a sparse set of baseline predictors and fed into a classifier. Visual interpretation of the cluster centroids is shown here. The right-hand side of each line represents the outcome date, i.e. ICU admission date or pseudo-admission date, with the 10 preceding GP visits displayed sequentially to the left, with the earliest visit represented by marker -10 and the most recent visit represented by marker -1. The length of each cluster indicates the total time for all 10 visits to occur, with each tick indicating individual GP interactions. The ICU admission rate for all the patients in each cluster was then calculated. Cluster 2, which represents a regular and frequent interaction pattern, was associated with the highest admission rate. When incorporated into classifiers, these clusters were found to be distinctly informative, outperforming demographic and clinical features alone, but improving predictive accuracy when combined together. This held true when tested across 3 types of classifier: logistic regression, gradient boosting classifier, and deep neural network. In conclusion, we showed how routinely collected data at the administrative level can be useful for clinical prediction. Over 65% of ICU admissions in the country of Wales have similar patterns of preceding primary care utilization, and temporal patterns of healthcare access can enrich critical deterioration prediction. Thank you very much for your time, and please feel free to contact me by email or on Twitter.